Hi, I'm Dr. David Hill, and today we're going to talk about how to tell if your child is on too much Focalin. Now, Focalin, which is a brand name for dexmethylphenidate, is one of a handful of medications that are very effective for treating attention deficit disorder or attention deficit hyperactivity disorder. There's really nothing in terms of therapy, diet, or other interventions that work as well as these medicines for children who really do have ADHD. That said, titrating the medications for attention deficit disorder, which I'll now call ADHD, can be a little bit tricky. It's trial and error. You never really know how one individual is going to respond. So when we prescribe these medicines, we need a lot of feedback from the parents to know how they're doing. Now, the first thing to know is that every child has to get a little used to the medicines. They have to build sort of a tolerance to the medicine as they start. So the side effects of attention deficit disorder medicines like Focalin will be more pronounced in the first week the child is on them. If you notice that your child is a little weepy at night, has a poor appetite, may be a little somnolent, may have some difficulty eating, or a little nausea or headache. If you just started the medicine, go ahead and touch base with your doctor if you'd like, but chances are good the advice you're going to get is let's give it a week and see how it goes. Now, if the child has been on the medicine for a couple of weeks and you're still seeing some of these symptoms, it may be that you do want to cut back the dose. Usually we start at the lowest possible dose of these medicines and work our way up. But if the doctor decided for some reason to start at a higher dose, you may have a chance to knock it back a little bit and see if the symptoms go away. It also may be that this just isn't the medicine for your child. There is not one best attention deficit disorder medicine. We know that all the ones we use work. Some of them work better for some children, some are better for another. So you're also going to want to keep touch with your child's teachers. Look at the homework. How is everything going? Are the behaviors, you should have target behaviors that you're looking at, are they better? If Johnny was speaking out of turn 12 times a day before the medicine, how many times is it now? Is it 6? Is it 3? Has it happened at all? Keep track of these things and discuss with the doctor who's prescribing these medicines for your child what are the symptoms that we are going to watch for in this particular child. How are we going to know it's working? So, to review, if your child is on too much Focalin, you may see poor appetite. You may see that he or she is getting upset around bedtime or later on in the evening as the Focalin goes away. You may notice that he or she is a little just down, perhaps a bit subdued. There may be some abdominal pain, there may be some nausea, there may be some headache. All of those things are worth keeping track of, and most importantly, these medicines require a lot of feedback between teachers, parents, and the prescribing physician. Never be afraid to pick up the phone and make a call to the person who's writing the prescription. Talking about how to know when your child's on too much Focalin, I'm Dr. David Hill.